Question 1. Examination of the data shows a registered nurse caring for a post-operative patient who is experiencing significant pain and has a new order for a stronger opioid analgesic. The nurse notes that the patient's respiratory rate has decreased from 16 to 12 breaths per minute. The nurse believes the new opioid may exacerbate respiratory depression and wants to discuss this concern with the physician before administering the medication. Which of the following actions best demonstrates interprofessional collaboration and professional nursing practice? Option A. Contact the physician to discuss the concern regarding the patient's respiratory rate and the potential impact of the new opioid, requesting clarification or a potential adjustment to the order. Option B. Discuss the concern with a fellow registered nurse on the unit to get their opinion on whether to administer the medication. Option C. Document the concern about the respiratory rate and the new opioid order in the patient's electronic health record without further immediate action. Option D. Administer the new opioid as ordered and closely monitor the patient's respiratory rate. The correct answer is D. Administer the new opioid as ordered and closely monitor the patient's respiratory rate. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with complex needs requiring coordinated care across multiple disciplines. The nurse's role is to advocate for the patient and ensure effective communication and collaboration among the healthcare team to achieve optimal outcomes. Failure to do so can lead to fragmented care, patient dissatisfaction, and potential adverse events. Correct approach analysis. The correct approach involves initiating a direct, respectful conversation with the physician to clarify the patient's needs and the rationale behind the current treatment plan. This aligns with the Nurse Practice Act for registered nurses, which emphasizes the nurse's responsibility in patient assessment, planning, and communication with the healthcare team. It upholds ethical principles of patient advocacy and beneficence by ensuring the patient receives appropriate and coordinated care. This proactive communication fosters interprofessional collaboration, a cornerstone of safe and effective healthcare delivery as outlined by professional nursing organizations and regulatory bodies. Incorrect approaches analysis. One incorrect approach involves proceeding with the current plan without seeking clarification. This fails to uphold the nurse's professional responsibility to assess and advocate for the patient, potentially leading to suboptimal care and violating the nurse's duty of care. It also bypasses the collaborative process, undermining team communication. Another incorrect approach is to discuss concerns with colleagues without directly addressing the physician. This can be perceived as unprofessional gossip and does not resolve the issue for the patient. It fails to engage the appropriate team member responsible for the medical plan and hinders effective interprofessional collaboration. A third incorrect approach is to document concerns in the patient's chart without first attempting to resolve them through direct communication. While documentation is crucial, it should follow attempts at resolution. This approach can be seen as passive and does not actively contribute to problem-solving or collaborative care, potentially delaying necessary adjustments to the patient's treatment. Professional reasoning. Professionals should utilize a systematic approach to address patient care concerns. This involves 1. Assessment, identifying the patient's needs and potential issues. 2. Communication, directly and respectfully engaging with the relevant healthcare provider to clarify and problem solve. 3. Advocacy, acting in the patient's best interest to ensure appropriate care. 4. Documentation, recording all assessments, interventions, and communications accurately. This framework ensures that patient care is safe, effective, and collaborative. Question 2. Performance analysis shows that a registered nurse is preparing to discharge a patient newly diagnosed with type 2 diabetes who requires instruction on daily insulin injections. The nurse needs to select the most effective teaching method to ensure the patient understands the procedure and can administer it safely at home. Which teaching method is most likely to promote optimal patient comprehension and adherence? Option A. Explaining the procedure verbally, providing a written guide with diagrams, and having the patient perform a return demonstration. Option B. Providing a detailed pamphlet on diabetes management and insulin administration, assuming the patient will read and understand it independently. Option C. Relying solely on a brief verbal explanation of the injection process, as the patient appears to be in a hurry. Option D. Demonstrating the insulin injection technique once, then asking the patient to verbally describe the steps. The correct answer is B. providing a detailed pamphlet on diabetes management and insulin administration, assuming the patient will read and understand it independently. Explanation. Scenario analysis. This scenario presents a common challenge in nursing education, adapting teaching methods to meet diverse learner needs and ensure comprehension of critical health information. The professional challenge lies in selecting the most effective teaching strategy that promotes patient understanding and adherence to a complex treatment regimen, directly impacting patient safety and outcomes. Careful judgment is required to move beyond a one-size-fits-all approach and embrace methods that cater to individual learning styles and cognitive abilities. Correct approach analysis. The correct approach, utilizing a combination of verbal explanation, written materials, and a return demonstration, represents best professional practice because it aligns with established principles of adult learning theory and patient education guidelines. This multimodal approach acknowledges that individuals learn in different ways and at different paces. Verbal explanation provides immediate clarification and allows for interactive questioning. Written materials serve as a reference and reinforce key information. The return demonstration is crucial for assessing comprehension and skill acquisition, ensuring the patient can safely and effectively manage their condition. This aligns with the nursing process of assessment, diagnosis, planning, implementation, and evaluation, where evaluating patient understanding is a critical step. Regulatory frameworks, such as those guiding the NCSBN examination, emphasize the nurse's responsibility to provide clear, understandable patient education to promote self-care and prevent adverse events. Incorrect approach is analysis. An approach solely relying on verbal explanation, without any visual aids or opportunity for practice, fails to account for potential auditory processing deficits or information overload. This can lead to superficial understanding and poor retention, violating the ethical principle of beneficence by not ensuring the patient receives adequate information to manage their health. It also fails to meet the standard of care for patient education, which requires clear and comprehensive instruction. An approach that provides only written materials, without verbal explanation or demonstration, may be ineffective for patients with low literacy, visual impairments, or cognitive challenges. This neglects the diversity of patient populations and their varying abilities to access and process information, potentially leading to non-adherence and negative health outcomes, which is a failure in providing safe and effective care. An approach that focuses exclusively on a demonstration without verbal explanation or written reinforcement may overwhelm the patient with technical steps without providing the underlying rationale or allowing for questions. This can lead to rote memorization rather than true understanding, increasing the risk of errors when the patient attempts the procedure independently. This approach also fails to empower the patient with the knowledge to troubleshoot or adapt to unexpected situations. Professional reasoning. Professionals should employ a patient-centered approach to education. This involves assessing the patient's current knowledge, learning preferences, and any barriers to learning, e.g., language, literacy, cognitive status. Based on this assessment, the nurse should select and adapt teaching methods to optimize comprehension and retention. The teach-back method, where the patient explains the information back to the nurse in their own words, is a valuable tool for evaluating understanding and identifying areas needing further clarification. This iterative process ensures that education is effective and tailored to the individual's needs, promoting safe and informed self-care. Question 3. Benchmark analysis indicates that registered nurses often face challenges when a patient's deeply held cultural beliefs appear to conflict with recommended medical interventions. A patient, who is a recent immigrant, expresses significant apprehension about a prescribed medication due to beliefs rooted in their traditional healing practices, stating it will disrupt their spiritual balance. The nurse's primary responsibility is to ensure the patient receives safe and effective care while respecting their autonomy and cultural background. Which of the following patient education strategies best addresses this implementation challenge? Option A. Inform the patient that if they refuse the medication based on their beliefs, the nurse will have to document this refusal and cannot continue to provide care, as it would be a breach of professional duty. Option B. Proceed with administering the medication as prescribed, assuming that once the patient sees the positive effects, their cultural beliefs will naturally diminish in importance. Option C. Gently but firmly explain that traditional healing practices are not scientifically proven and that the prescribed medication is essential for their physical health, urging them to set aside their beliefs for the sake of their well-being. Option D. Explore the patient's understanding of their traditional healing practices and the perceived spiritual imbalance. Then collaboratively discuss how the prescribed medication might be integrated or managed to minimize perceived disruption, while clearly explaining the medical necessity and potential risks of not taking the medication. The correct answer is D. Explore the patient's understanding of their traditional healing practices and the perceived spiritual imbalance. Then collaboratively discuss how the prescribed medication might be integrated or managed to minimize perceived disruption, while clearly explaining the medical necessity and potential risks of not taking the medication. Explanation. Scenario analysis. This scenario presents a common challenge in nursing practice where a patient's cultural beliefs may conflict with standard medical advice. The nurse must navigate this delicate situation with sensitivity, respecting the patient's autonomy and cultural identity while ensuring their safety and well-being. The challenge lies in balancing the nurse's professional responsibility to provide evidence-based care with the patient's right to make informed decisions based on their own values and beliefs. Failure to do so can lead to mistrust, non-adherence, and potentially negative health outcomes. Correct approach analysis. The correct approach prioritizes open communication, cultural humility, and collaborative decision-making. By actively listening to the patient's concerns and understanding the cultural significance of their beliefs, the nurse can build rapport and trust. This allows for more effective discussion about the risks and benefits of treatment options, empowering the patient to make an informed choice that aligns with both their health needs and cultural values. This aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes respecting patient autonomy, dignity, and cultural diversity. It also adheres to the principles of patient-centered care, a cornerstone of nursing practice in the United States. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's beliefs as irrelevant or superstitious. This demonstrates a lack of cultural competence and disrespects the patient's autonomy, violating ethical principles of non-maleficence and beneficence, can also lead to a breakdown in the nurse-patient relationship, hindering future care. Another incorrect approach is to proceed with a treatment plan without fully addressing the patient's concerns or ensuring their understanding. This fails to uphold the principle of informed consent, a legal and ethical requirement in U.S. healthcare. The patient must have the opportunity to ask questions and receive clear, understandable information before agreeing to any medical intervention. A third incorrect approach is to impose the nurse's own beliefs or values on the patient. This is a clear violation of professional boundaries and ethical standards, prioritizing the nurse's personal views over the patient's right to self-determination. It can also lead to accusations of discrimination and a loss of professional credibility. Professional reasoning. When faced with a conflict between patient beliefs and recommended care, the professional reasoning process should involve 1. Active listening and empathetic inquiry to understand the patient's perspective and the cultural context. 2. Education about the medical condition and treatment options, presented in a clear, culturally sensitive, and understandable manner, including potential risks and benefits. 3. Collaborative problem solving to identify mutually acceptable solutions or compromises that respect both medical necessity and cultural values. 4. Documentation of the discussion, the patient's decision, and the rationale for the chosen course of action. This systematic approach ensures patient safety, promotes adherence, and upholds ethical and legal standards. Question 4. Analysis of a registered nurse's response when a patient's family insists on a treatment modality for their loved one, citing anecdotal success stories they encountered online, while the nurse's review of current, peer-reviewed nursing research indicates a different, evidence-based approach is recommended for optimal patient outcomes. Option A. The nurse immediately implements the treatment modality suggested by the family, prioritizing their immediate comfort and request over established research protocols. Option B. The nurse agrees to the family's requested treatment without consulting current research, assuming their online information might hold some validity. Option C. The nurse dismisses the family's concerns outright, stating that their understanding of medical treatments is likely misinformed and that the nurse's professional judgment is sufficient. Option D. The nurse respectfully explains the findings from current nursing research to the family, detailing why the evidence-based approach is considered more effective and safer, and offers to discuss the findings further with the healthcare team. Correct answer is D. The nurse respectfully explains the findings from current nursing research to the family, detailing why the evidence-based approach is considered more effective and safer, and offers to discuss the findings further with the healthcare team. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the immediate needs of a patient with the imperative to integrate evidence-based practice into care. The patient's family, while well-intentioned, is advocating for a treatment based on anecdotal evidence rather than current research, creating a potential conflict between patient comfort and optimal clinical outcomes. The nurse must navigate this delicate situation with empathy, respect, and a commitment to professional standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the application of current, evidence-based research to patient care. Registered nurses in the United States are ethically and legally obligated to provide care that aligns with the best available scientific knowledge, as outlined by professional nursing organizations and state boards of nursing. This approach ensures the patient receives the most effective and safe treatment, grounded in rigorous study, rather than relying on outdated or unproven methods. It also involves educating the family in a respectful manner, fostering trust and understanding. Incorrect approaches analysis. One incorrect approach involves immediately dismissing the family's request and insisting on the current protocol without further discussion. This fails to acknowledge the family's concern and can erode trust, potentially leading to patient dissatisfaction and a breakdown in the nurse-patient-family relationship. Ethically, it neglects the principle of patient-centered care and shared decision-making. Another incorrect approach is to agree to the family's request without verifying its basis in current research. This could lead to the administration of an ineffective or even harmful treatment, violating the nurse's duty to provide safe and competent care as mandated by state nurse practice acts and the American Nurses Association ANA Code of Ethics. It also bypasses the critical step of evaluating research findings. A third incorrect approach is to become defensive or dismissive of the family's concerns, implying their understanding is inferior. This unprofessional behavior undermines the therapeutic relationship and fails to uphold the ANA Code of Ethics, which emphasizes respect for persons and dignity. It also misses an opportunity to educate the family and advocate for evidence-based care. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening to understand the family's concerns and the basis of their request. Next, they should access and critically appraise current research relevant to the patient's condition and the proposed treatment. This involves consulting reputable databases and professional guidelines. The nurse should then communicate findings clearly and compassionately to the family, explaining the rationale behind evidence-based recommendations and addressing any misconceptions. If there is a significant discrepancy between the family's request and current evidence, the nurse should involve the healthcare team, including the physician, to facilitate a collaborative discussion and decision. Question 5. The assessment process reveals a 78-year-old client admitted for management of chronic obstructive pulmonary disease, COPD, exacerbation, who is exhibiting increased anxiety and difficulty following instructions for their new inhaler technique. The nurse needs to determine the most appropriate initial nursing action to address the client's anxiety and adherence to the new treatment regimen. Option A. Reassess the client's understanding of the new inhaler technique, considering potential age-related cognitive changes and the impact of anxiety on learning. Option B. Focus solely on the physical symptoms of the COPD exacerbation, as anxiety and adherence issues are secondary to the acute respiratory distress. Option C. Administer a prescribed anxiolytic medication to reduce the client's anxiety and improve their ability to learn. Option D. Immediately contact the client's adult children to explain the situation and request their assistance in reinforcing the inhaler instructions. The correct answer is C. Administer a prescribed anxiolytic medication to reduce the client's anxiety and improve their ability to learn. Explanation. This scenario is professionally challenging because it requires the nurse to integrate knowledge of developmental stages across the lifespan with the specific needs and potential vulnerabilities of a patient presenting with a complex, non-acute issue. The nurse must move beyond a superficial understanding of developmental milestones to apply this knowledge in a way that promotes patient autonomy, respects individual differences, and ensures appropriate care planning. Careful judgment is required to avoid ageist assumptions or stereotyping, which can lead to suboptimal care and violate ethical principles. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers the individual's unique developmental context. This aligns with the Nurse Practice Act and the American Nurses Association, ANA, Code of Ethics, which mandate that nurses provide patient-centered care, respect patient dignity and autonomy, and advocate for the patient's best interests. By gathering information about the patient's cognitive, social, and emotional development, the nurse can tailor interventions to be most effective and promote optimal outcomes, respecting the patient as a whole person within their life stage. An incorrect approach that focuses solely on the presenting physical complaint, without considering the developmental context, fails to meet the standard of holistic nursing care. This could lead to interventions that are not understood or accepted by the patient, potentially violating the ethical principle of beneficence by not maximizing the patient's well-being. Another incorrect approach that makes assumptions based on age alone, without individual assessment, constitutes ageism and can lead to discrimination, violating the ethical principle of justice and the regulatory requirement for non-discriminatory care. Furthermore, an approach that bypasses the patient and communicates only with family members without assessing the patient's capacity for involvement or consent could violate patient autonomy and privacy regulations. Professionals should use a decision-making framework that begins with a thorough, individualized assessment. This involves gathering subjective and objective data, including information relevant to the patient's developmental stage and its impact on their current situation. The nurse should then analyze this data, considering how developmental factors influence the patient's understanding, decision-making capacity, and ability to participate in their care. Interventions should be planned collaboratively with the patient, respecting their autonomy and promoting their engagement. Ongoing evaluation of the effectiveness of interventions, considering the developmental context, is crucial for continuous quality improvement and ethical care delivery. Question 6. Compliance review shows a registered nurse is providing care to a patient who expresses strong personal beliefs that contradict recommended public health guidelines for a specific communicable disease prevention strategy. The nurse needs to address this discrepancy to promote the patient's health and safety. Which of the following actions best reflects adherence to professional nursing standards and ethical practice in this situation? Option A. Present the recommended strategy as superior and subtly imply that the patient's beliefs are uninformed or irrational. Option B. Firmly explain that the recommended strategy is the only acceptable course of action and insist the patient comply for their own good and the safety of others. Option C. Avoid discussing the conflicting beliefs and focus solely on other aspects of the patient's care to prevent potential conflict. Option D. Explore the patient's understanding of the disease, their concerns about the recommended strategy, and collaboratively develop a personalized plan that incorporates their values while still addressing health risks. The correct answer is D. Explore the patient's understanding of the disease, their concerns about the recommended strategy, and collaboratively develop a personalized plan that incorporates their values while still addressing health risks. Explanation. Scenario analysis. This scenario presents a common challenge in health promotion, where a nurse must balance individual patient autonomy with the public health imperative of disease prevention. The patient's personal beliefs and lifestyle choices directly conflict with recommended health practices, requiring the nurse to navigate a sensitive situation without being coercive or judgmental. The challenge lies in providing effective health education that respects the patient's values while still promoting their well-being and potentially preventing the spread of communicable diseases. Correct approach analysis. The correct approach emphasizes patient-centered care and shared decision-making, aligning with the ethical principles of autonomy and beneficence, and the regulatory framework of the Nurse Practice Act, which mandates providing safe and effective care. By exploring the patient's understanding, concerns, and motivations, the nurse can tailor the health promotion strategies to be more acceptable and effective. Offering evidence-based information in a non-judgmental manner empowers the patient to make informed choices, fostering a therapeutic relationship built on trust. This approach respects the patient's right to self-determination while still fulfilling the nurse's professional responsibility to promote health. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns and insisting on a specific course of action. This violates the principle of autonomy, as it disregards the patient's right to make their own decisions, and can damage the nurse-patient relationship, making future health interventions less likely to succeed. It also fails to address the underlying reasons for the patient's resistance, rendering the intervention ineffective. Another incorrect approach is to avoid the topic altogether due to discomfort or fear of confrontation. This constitutes a failure to uphold the nurse's professional duty to promote health and prevent disease, as outlined in Nursing Standards of Practice and the Nurse Practice Act. It can lead to negative health outcomes for the patient and potentially for the community if the condition is communicable. A third incorrect approach is to present information in a condescending or judgmental tone. This erodes trust, alienates the patient, and is ethically unsound, violating the principle of respect for persons. It is also counterproductive to health promotion, as patients are less likely to engage with or accept advice from someone they perceive as critical. Professional reasoning. When faced with a patient whose beliefs or practices conflict with recommended health promotion strategies, the professional nurse should employ a process of respectful inquiry, active listening, and collaborative problem solving. The nurse should first assess the patient's current understanding and beliefs about the health issue. Then, they should clearly and empathetically present evidence-based information about the risks and benefits of different health behaviors, tailoring the language to the patient's comprehension level. The nurse should explore the patient's barriers to adopting recommended practices and work with the patient to identify realistic, achievable goals that align with their values and lifestyle. This process respects patient autonomy while fulfilling the nurse's ethical and professional obligation to promote health and well-being. Question 7. Research into parental hesitancy regarding childhood immunizations has highlighted the importance of effective communication strategies. A registered nurse is caring for a 4-month-old infant whose parents express significant anxiety about the recommended vaccination schedule, citing anecdotal information they found online. The nurse needs to address this situation while adhering to professional standards and ethical obligations. Which of the following actions best reflects appropriate nursing practice in this scenario? Option A. Politely but firmly inform the parents that the immunization schedule is non-negotiable and that refusal will result in the infant not being seen by the clinic. Option B. Agree with the parents' concerns, stating that there are indeed many valid reasons to delay or refuse vaccinations due to potential risks. Option C. Provide the parents with a pamphlet on immunizations and tell them to read it and decide when they feel ready, without further discussion. Option D. Validate the parents' concerns, actively listen to their specific anxieties, and then provide clear, evidence-based information about vaccine safety, efficacy, and the risks of vaccine-preventable diseases, encouraging further discussion. The correct answer is D. Validate the parents' concerns, actively listen to their specific anxieties, and then provide clear, evidence-based information about vaccine safety, efficacy, and the risks of vaccine-preventable diseases, encouraging further discussion. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric nursing where a parent expresses concerns about immunizations, creating a conflict between established public health recommendations and parental autonomy. The nurse must navigate this situation with sensitivity, ensuring the child's well-being while respecting the parent's right to make informed decisions. The professional challenge lies in providing accurate, evidence-based information without alienating the parent or compromising the nurse's ethical obligation to advocate for the child's health. Correct approach analysis. The correct approach involves a thorough, empathetic, and educational discussion with the parent. This aligns with the principles of patient-centered care and informed consent, which are foundational to nursing practice under the Nurse Practice Act and ethical codes. By actively listening to the parents' concerns, validating their feelings, and then providing clear, evidence-based information about vaccine safety and efficacy, the nurse empowers the parent to make an informed decision. This approach respects parental rights while fulfilling the nurse's duty to promote public health and prevent communicable diseases, as outlined by the Centers for Disease Control and Prevention, CDC, immunization guidelines, which are integral to nursing practice in the U.S. Incorrect approaches analysis. One incorrect approach involves dismissing the parent's concerns and insisting on immediate vaccination. This violates the ethical principle of respect for autonomy and can erode trust between the nurse and the family. It fails to uphold the requirement for informed consent, which necessitates a dialogue and understanding of the information provided. Furthermore, it disregards the professional responsibility to address parental anxieties with compassion and evidence. Another incorrect approach is to provide incomplete or biased information, focusing only on potential side effects without balancing it with the overwhelming evidence of vaccine benefits and the risks of vaccine-preventable diseases. This is a failure of professional integrity and violates the ethical obligation to provide accurate and comprehensive information. It also contravenes public health recommendations and guidelines that emphasize the safety and effectiveness of recommended immunization schedules. A third incorrect approach is to defer the decision entirely to the parent without offering any professional guidance or education. While respecting parental autonomy is crucial, nurses have a professional and ethical responsibility to advocate for the child's health and well-being by providing accurate information and recommendations based on established medical science and public health policy. This passive approach neglects the nurse's role as a health educator and advocate. Professional reasoning. Professionals should approach such situations by first establishing a trusting relationship with the parent. This involves active listening and empathy. Next, the nurse should assess the parent's specific concerns and misconceptions. Following this, the nurse should provide clear, accurate, and evidence-based information about immunizations, addressing the parent's concerns directly. This information should be presented in a way that is understandable and non-judgmental. The goal is to facilitate an informed decision, not to coerce. If the parent remains hesitant, the nurse should explore options for further discussion, perhaps with a healthcare provider, and reiterate the importance of the child's health and community protection. Question 8. The performance metrics show a decrease in the average time spent per patient on the unit, and the nurse is feeling pressure to increase efficiency. A patient who is visibly distressed and tearful states, "I just feel so alone and scared." The nurse has several tasks to complete before the end of the shift. Which of the following actions best demonstrates adherence to Watson's theory of human caring in this situation? Option A. Inform the patient that the unit is very busy and that their feelings are understandable, but that the nurse must attend to other urgent patient needs. Option B. Briefly acknowledge the patient's feelings and reassure them that they are in good hands, then proceed with completing the remaining tasks. Option C. Ask a colleague to check in on the patient and offer emotional support while the nurse finishes their assigned duties. Option D. Sit with the patient for a few minutes, hold their hand, and ask open-ended questions about what is making them feel scared and alone. The correct answer is D. Sit with the patient for a few minutes, hold their hand, and ask open-ended questions about what is making them feel scared and alone. Explanation. Scenario analysis. This scenario is professionally challenging because it pits the nurse's ethical commitment to compassionate care, as outlined in Watson's theory of human caring, against the perceived demands of efficiency and measurable outcomes. The pressure to meet performance metrics can create a conflict between the qualitative aspects of nursing care and quantitative data, requiring careful judgment to ensure patient well-being and dignity are not compromised. Correct approach analysis. The correct approach, which prioritizes spending time with the patient to understand their emotional state and offer comfort, directly aligns with Watson's theory of human caring. This theory emphasizes the importance of the transpersonal caring relationship, the subjective experience of the patient, and the nurse's authentic presence. By focusing on the patient's feelings and offering a comforting touch, the nurse is enacting core tenets of caring, fostering trust, and promoting healing beyond purely physical interventions. This approach is ethically sound and reflects best professional practice by honoring the patient as a whole person, not just a set of clinical indicators. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's emotional distress as a secondary concern, focusing solely on completing tasks to meet performance metrics. This fails to recognize the holistic nature of care and the impact of emotional well-being on physical recovery, violating the ethical principle of beneficence and the spirit of Watson's theory. It reduces the patient to a task list, neglecting their subjective experience and the transpersonal dimension of nursing. Another incorrect approach would be to delegate the emotional support to another staff member without assessing the patient's specific needs or the appropriateness of the delegation. While delegation is a professional skill, doing so without a thorough understanding of the patient's unique situation and the nurse's primary responsibility for establishing a caring relationship can lead to fragmented care and a failure to meet the patient's deeper needs. This can be seen as an abdication of the nurse's direct caring responsibility. A third incorrect approach would be to offer platitudes or generic reassurances without genuine engagement or an attempt to understand the patient's distress. This superficial interaction, while appearing to address the emotional aspect, lacks the authenticity and presence central to Watson's theory. It fails to establish a transpersonal connection and can leave the patient feeling unheard and uncared for, undermining the therapeutic relationship. Professional reasoning. Professionals should employ a decision-making framework that integrates ethical principles with theoretical underpinnings of nursing. When faced with conflicting demands, such as performance metrics versus patient-centered care, the nurse must first assess the patient's immediate needs, both physical and emotional. This assessment should then be weighed against the nurse's ethical obligations and professional responsibilities. Watson's theory provides a framework for understanding the qualitative aspects of care that are essential for patient well-being. The nurse should advocate for the patient's needs, even if it means challenging existing metrics or protocols, by articulating how a more holistic, caring approach ultimately leads to better patient outcomes. This involves clear communication with the healthcare team, and if necessary, with supervisors, to ensure that patient care remains the paramount concern. Question 9. Risk assessment procedures indicate that a newly diagnosed diabetic patient, Mr. Henderson, is scheduled for discharge tomorrow. The nurse is responsible for providing essential education regarding insulin administration, blood glucose monitoring, and dietary modifications. Mr. Henderson appears anxious and states, "I'm not sure I can remember all of this." The nurse has a limited amount of time before Mr. Henderson's family arrives to take him home. Which of the following teaching strategies would be most effective in addressing Mr. Henderson's learning needs and ensuring comprehension? Option A. Utilize a combination of verbal explanations, demonstration of insulin injection technique, and provide a clear, concise pamphlet with diagrams for him to review at home. Option B. Verbally explain the entire insulin administration process, blood glucose monitoring steps, and dietary recommendations in detail, assuming he will ask questions if he is unsure. Option C. Provide Mr. Henderson with a comprehensive textbook on diabetes management and instruct him to read it thoroughly before his next appointment. Option D. Focus solely on demonstrating the insulin injection technique, assuming he will be able to infer the other necessary information from observing the demonstration. The correct answer is A. Utilize a combination of verbal explanations, demonstration of insulin injection technique, and provide a clear, concise pamphlet with diagrams for him to review at home. Explanation. This scenario is professionally challenging because it requires the registered nurse to adapt their teaching methods to meet the diverse learning needs of a patient, ensuring effective health education and promoting patient safety and adherence to treatment. Failure to do so can lead to poor health outcomes and non-compliance. The correct approach represents best professional practice because it aligns with the nursing process and ethical principles of patient-centered care, as mandated by the Nurse Practice Act and the American Nurses Association ANA Code of Ethics. Specifically, it emphasizes individualized patient education, which is crucial for effective learning and empowers the patient to actively participate in their care. This approach respects the patient's autonomy and promotes health literacy, a key component of quality nursing care. An incorrect approach that relies solely on verbal instruction fails to acknowledge the patient's potential auditory learning style limitations and may result in incomplete understanding or retention of critical information. This could be considered a breach of the nurse's duty to provide adequate education, potentially violating standards of care and leading to adverse patient events. Another incorrect approach that focuses only on written materials overlooks the possibility that the patient may not be a strong visual or reading learner, or may have visual impairments. This can lead to frustration and a lack of comprehension, hindering the patient's ability to manage their health effectively. Ethically, this fails to provide equitable access to information and support for all patients. A third incorrect approach that assumes the patient will seek clarification if needed, without proactively assessing their understanding or offering multiple avenues for learning, places an undue burden on the patient and may not be effective for individuals who are hesitant to ask questions or are unaware of what they don't understand. This can be seen as a failure to advocate for the patient's learning needs. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including identifying their preferred learning styles and any barriers to learning. Based on this assessment, the nurse should then develop an individualized teaching plan that incorporates a variety of methods, such as verbal explanations, visual aids, demonstrations, and hands-on practice. Ongoing evaluation of the patient's understanding and adjustment of teaching strategies are essential to ensure effective learning and promote optimal health outcomes. This aligns with the principles of evidence-based practice and patient advocacy. Question 10. Which approach would be most appropriate for a registered nurse who identifies that a patient's current care plan for managing chronic pain is based on a protocol that has been superseded by more recent, evidence-based guidelines recommending a different pharmacological approach? Option A. Seek out current research and guidelines, discuss the findings with the physician, and advocate for an updated care plan. Option B. Continue to follow the existing care plan as it is the established protocol. Option C. Inform the patient that their current treatment is outdated but continue with it until a new physician order is received. Option D. Immediately implement the new pharmacological approach without consulting the physician. Correct answer is B. Continue to follow the existing care plan as it is the established protocol. Explanation. Scenario analysis. This scenario presents a common challenge in nursing practice, where a nurse encounters a patient whose care plan is based on outdated evidence. The professional challenge lies in balancing adherence to the established care plan with the ethical and professional obligation to provide the highest standard of care, which necessitates incorporating current best practices. This requires critical thinking, effective communication, and a commitment to patient advocacy. Correct approach analysis. The correct approach involves a systematic process of evaluating the existing care plan against current evidence, collaborating with the healthcare team, and advocating for necessary changes. This aligns with the core principles of evidence-based practice as promoted by nursing regulatory bodies in the U.S., such as the American Nurses Association (ANA) standards of practice. Specifically, the ANA standards emphasize the nurse's role in professional practice evaluation and quality improvement, which includes integrating research findings into practice. By seeking out current research, discussing findings with the physician, and proposing an updated intervention, the nurse demonstrates a commitment to patient safety and optimal outcomes, fulfilling their professional and ethical duties. Incorrect approaches analysis. One incorrect approach involves continuing to follow the outdated care plan without questioning it. This fails to uphold the professional responsibility to provide evidence-based care and could potentially lead to suboptimal patient outcomes or even harm. It represents a failure to engage in critical thinking and professional development, which are essential for maintaining licensure and providing competent nursing care under U.S. nursing regulations. Another incorrect approach is to unilaterally change the patient's care without consulting the physician or other members of the healthcare team. This violates the principles of collaborative practice and can undermine the interdisciplinary approach to patient care, which is a cornerstone of safe and effective healthcare delivery in the U.S. It also bypasses established protocols for modifying treatment plans, potentially leading to errors or conflicts within the team. A third incorrect approach is to dismiss the new evidence without further investigation, perhaps due to time constraints or a belief that the current practice is sufficient. This demonstrates a lack of commitment to continuous learning and quality improvement, which are fundamental to professional nursing practice and are often implicitly or explicitly required by state boards of nursing. It also risks perpetuating ineffective or potentially harmful practices. Professional reasoning. Professionals should approach such situations by first recognizing the discrepancy between current practice and emerging evidence. The next step involves a thorough literature search to validate the new evidence. Following this, open and respectful communication with the physician and other relevant healthcare providers is crucial to discuss the findings and their implications for the patient's care. If consensus is reached, the care plan should be updated accordingly. If disagreement arises, further discussion, consultation with evidence-based practice specialists, or escalation through appropriate channels may be necessary to ensure the patient receives the most effective care. This systematic, collaborative, and evidence-driven process is essential for ethical and professional nursing practice. Question 11. The review process indicates a need to evaluate a registered nurse's application of nursing models and theories in developing a care plan for an elderly patient experiencing a chronic illness and expressing a desire to maintain independence at home. Which of the following theoretical approaches would best guide the nurse in creating a plan that prioritizes patient autonomy and self-management? Option A. Utilizing Orum's self-care deficit theory to identify deficits and develop interventions that empower the patient to perform self-care activities. Option B. Adopting a purely biomedical model that focuses on the physiological aspects of the disease and its treatment. Option C. Applying the principles of the health belief model to assess the patient's perceptions of susceptibility and severity of their illness. Option D. Implementing interventions based solely on the latest clinical practice guidelines for the specific chronic illness. The correct answer is A. Utilizing Orum's self-care deficit theory to identify deficits and develop interventions that empower the patient to perform self-care activities. Explanation. The review process indicates a need to assess the nurse's understanding of how nursing models and theories guide clinical practice, particularly in patient-centered care. This scenario is professionally challenging because it requires the nurse to move beyond rote task completion and apply theoretical frameworks to complex patient situations, ensuring that care is individualized and respects patient autonomy and values. Careful judgment is required to select the most appropriate theoretical lens for a given patient's needs. The correct approach represents best professional practice because it demonstrates the nurse's ability to integrate theoretical knowledge into the assessment and planning phases of the nursing process. By selecting a model that emphasizes patient-centeredness and self-care, the nurse is aligning with the core principles of modern nursing, which prioritize patient involvement and empowerment. This aligns with the ethical obligation to respect patient autonomy and promote well-being, as often underscored by nursing practice standards and ethical codes that guide registered nurses in the United States. An incorrect approach that focuses solely on disease-specific protocols without considering the patient's individual experience or preferences fails to acknowledge the holistic nature of nursing care. This can lead to care that is technically correct but emotionally or psychologically detrimental to the patient, potentially violating the ethical principle of beneficence by not maximizing the patient's overall well-being. Furthermore, it may neglect the patient's right to self-determination, a key component of patient-centered care. Another incorrect approach that prioritizes the nurse's personal beliefs or assumptions over the patient's stated needs or values is a direct violation of ethical practice. This can lead to paternalistic care and erodes the trust essential for the nurse-patient relationship. Such an approach disregards the regulatory expectation that nurses provide care without prejudice and respect the diversity of patient backgrounds and beliefs. A third incorrect approach that relies on outdated or irrelevant theoretical models may result in inefficient or ineffective care. While theoretical knowledge is crucial, its application must be current and relevant to contemporary healthcare challenges and patient populations. Failure to utilize appropriate theoretical frameworks can hinder the nurse's ability to critically analyze situations and develop optimal care plans, potentially impacting patient outcomes and falling short of the expected standard of care. The professional reasoning process for similar situations involves first identifying the core nursing problem or patient need. Then, the nurse should consider various nursing models and theories that could inform their approach. The next step is to evaluate which model best aligns with the patient's unique situation, values, and goals, as well as the overall philosophy of care within the healthcare setting. This involves active listening, patient engagement, and a critical assessment of theoretical applicability to ensure patient-centered, ethical, and effective nursing care. Question 12. The analysis reveals a registered nurse is caring for a patient from a different cultural background who expresses reluctance towards a recommended diagnostic procedure, citing deeply held spiritual beliefs that prohibit such interventions. The nurse needs to determine the most appropriate course of action to ensure culturally competent and ethical care. Which of the following approaches best reflects professional nursing practice in this situation? Option A. Gently explain the medical necessity of the procedure, explore the patient's specific concerns related to their spiritual beliefs, and collaboratively discuss potential modifications or alternative approaches that respect both the medical goals and the patient's values. Option B. Inform the patient that their spiritual beliefs are not medically relevant and that the procedure must be performed for their own good, overriding their objections. Option C. Immediately consult with a spiritual advisor to convince the patient to undergo the recommended procedure, without directly addressing the patient's expressed concerns first. Option D. Proceed with the diagnostic procedure as ordered by the physician, assuming the patient will eventually comply once they understand the seriousness of their condition. The correct answer is A. Gently explain the medical necessity of the procedure, explore the patient's specific concerns related to their spiritual beliefs, and collaboratively discuss potential modifications or alternative approaches that respect both the medical goals and the patient's values. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to navigate a patient's deeply held cultural beliefs that may conflict with standard medical recommendations. The nurse must balance the patient's right to self-determination and cultural autonomy with the professional obligation to provide safe and effective care. Failure to address the cultural aspect can lead to patient distrust, non-adherence, and potentially negative health outcomes, while a culturally insensitive approach can cause offense and alienate the patient. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing open communication and collaborative decision-making. This aligns with the ethical principles of respect for autonomy and beneficence, as well as the professional standards of nursing practice that emphasize patient-centered care. By actively seeking to understand the patient's beliefs and involving them in the care plan, the nurse upholds the patient's dignity and fosters a therapeutic relationship built on trust. This approach respects the patient's right to make informed decisions about their health, even if those decisions differ from the nurse's initial recommendations, provided the patient is fully informed of the risks and benefits. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's beliefs as superstition or ignorance. This is a failure of cultural competence and violates the ethical principle of respect for persons. It can lead to the patient feeling devalued and misunderstood, potentially causing them to disengage from care. This approach also fails to meet the professional standard of providing holistic care, which includes understanding and respecting a patient's cultural background. Another incorrect approach is to proceed with the standard medical treatment without attempting to integrate or accommodate the patient's cultural practices. This demonstrates a lack of cultural sensitivity and can be perceived as coercive or disrespectful. It fails to acknowledge the patient's right to cultural expression and can create a barrier to effective communication and adherence. Ethically, it prioritizes the nurse's agenda over the patient's values and preferences. A third incorrect approach is to impose the nurse's own cultural or religious beliefs onto the patient. This is a clear violation of professional boundaries and the ethical principle of non-maleficence, as it can cause distress and harm to the patient. It also demonstrates a severe lack of cultural competence and an inability to provide objective, patient-centered care. Professional reasoning. Professionals should utilize a decision-making process that begins with active listening and open-ended questioning to understand the patient's perspective. This should be followed by an assessment of how the patient's beliefs might impact their health status and treatment adherence. The next step involves educating the patient about their condition and the rationale behind recommended treatments, while also exploring ways to respectfully integrate their cultural practices into the care plan, if feasible and safe. Collaboration with the patient, their family, if appropriate and with consent, and potentially cultural liaisons or interpreters is crucial. The ultimate goal is to develop a mutually agreed-upon care plan that respects the patient's autonomy and promotes their well-being. Question 13. Compliance review shows a registered nurse is caring for an adult patient who has been prescribed a new medication to manage a chronic condition. The patient, who appears alert and oriented, verbally refuses to take the medication, stating they don't like taking pills. The nurse believes the medication is crucial for the patient's long-term health and preventing serious complications. What is the most appropriate initial nursing action? Option A. Immediately administer the medication, explaining to the patient that it is necessary for their health and they have no choice. Option B. Conduct a comprehensive assessment to determine the patient's understanding of the medication, the rationale for its use, potential risks of refusal, and their capacity to make this decision. Option C. Contact the patient's family to explain the importance of the medication and ask them to persuade the patient to take it. Option D. Document the patient's refusal and inform the physician that the patient will not be taking the prescribed medication. The correct answer is B. Conduct a comprehensive assessment to determine the patient's understanding of the medication, the rationale for its use, potential risks of refusal, and their capacity to make this decision. Explanation. Scenario analysis. This scenario presents a professional challenge due to a conflict between a patient's stated wishes and the nurse's assessment of potential harm. The nurse must balance patient autonomy with the ethical and legal duty to protect the patient from harm, all within the scope of registered nursing practice as defined by the Nurse Practice Act and ethical codes. The challenge lies in interpreting the patient's capacity to make informed decisions and determining when intervention is warranted, even if it contradicts the patient's immediate preference. Correct approach analysis. The correct approach involves a comprehensive assessment to determine the patient's capacity and the underlying reasons for their refusal. This aligns with the nursing process, which mandates thorough assessment before intervention. Specifically, it upholds the ethical principle of beneficence, acting in the patient's best interest, while respecting patient autonomy. Legally, it ensures that any deviation from the patient's wishes is justified by a clear and documented assessment of risk and diminished capacity, adhering to standards of care, and the Nurse Practice Act's provisions regarding patient safety and professional judgment. Incorrect approaches analysis. One incorrect approach involves immediately overriding the patient's refusal based on the nurse's personal belief about what is best. This violates the principle of patient autonomy and can be considered battery if performed without consent or a valid legal/ethical justification. It bypasses the essential assessment step and assumes the patient lacks capacity without proper evaluation, which is a failure to adhere to professional standards of care and ethical guidelines. Another incorrect approach is to document the refusal without further assessment or attempting to understand the patient's rationale. This neglects the nurse's responsibility to advocate for the patient and ensure their safety. It fails to fulfill the duty to assess for factors that might impair decision-making capacity or to explore alternative interventions that might be acceptable to the patient. This inaction can lead to patient harm and constitutes a breach of professional duty. A third incorrect approach is to immediately involve family members to persuade the patient without first conducting an independent assessment of the patient's capacity and wishes. While family involvement can be beneficial, it should not supersede the nurse's direct assessment and the patient's right to make their own decisions, especially if the patient is deemed to have capacity. This approach risks undermining the patient's autonomy and can create undue pressure, potentially leading to a decision that is not truly the patient's own. Professional reasoning. Professionals should employ a systematic decision-making process. First, conduct a thorough assessment of the patient's condition, including their understanding of their situation, the proposed treatment, and the alternatives. Second, evaluate the patient's capacity to make informed decisions, considering factors that might impair judgment. Third, explore the patient's reasons for refusal and any underlying fears or misconceptions. Fourth, consult with the healthcare team, including physicians and ethics committees if necessary, to ensure a collaborative and well-informed approach. Finally, document all assessments, interventions, and the patient's responses meticulously, ensuring that all actions are aligned with professional standards, ethical principles, and legal requirements. Question 14. The control framework reveals that a 45-year-old patient presents for a routine physical examination. During the assessment, the nurse discusses recommended health screenings and immunizations. The patient expresses some apprehension about receiving vaccinations, stating, "I've heard some concerning things, and I'm not sure if it's the right time for me." The nurse needs to determine the most appropriate next step in providing preventive care. Option A. Inform the patient that vaccinations are mandatory for their age and that delaying them is not an option, then proceed with administration. Option B. Provide the patient with comprehensive, evidence-based information about the recommended vaccinations, address their specific concerns, and collaboratively decide on a plan for proceeding with or deferring the vaccinations. Option C. Acknowledge the patient's apprehension but proceed with the vaccination, explaining that these are routine and necessary for their age group. Option D. Proceed with administering the recommended vaccinations as per standard protocol, assuming the patient will agree once the process begins. Correct answer is B. Provide the patient with comprehensive, evidence-based information about the recommended vaccinations, address their specific concerns, and collaboratively decide on a plan for proceeding with or deferring the vaccinations. Explanation. This scenario is professionally challenging because it requires the nurse to balance patient autonomy with the nurse's ethical and legal responsibility to promote health and prevent disease. The nurse must assess the patient's understanding and readiness for preventive care, while respecting their right to make informed decisions about their health. The correct approach represents best professional practice because it prioritizes patient education and shared decision-making, aligning with the principles of patient-centered care and informed consent. which are fundamental to nursing practice under the NCSBN regulatory framework. This approach empowers the patient to actively participate in their health management, fostering trust and adherence to preventive strategies. It also adheres to guidelines for health screening and preventive care, which emphasize individualized assessment and patient engagement. An incorrect approach that involves directly administering vaccinations without further discussion fails to respect patient autonomy and informed consent. This violates ethical principles and potentially regulatory requirements that mandate patient understanding and agreement before medical interventions. Another incorrect approach, which involves dismissing the patient's concerns and proceeding with the screening, disregards the patient's right to express their values and preferences. This can lead to a breakdown in the nurse-patient relationship and may result in noncompliance with recommended health practices. It also fails to acknowledge the importance of addressing patient barriers to care, a key component of effective preventive health strategies. A further incorrect approach, such as delaying the screening indefinitely due to the patient's initial hesitation, may not be in the patient's best interest for preventive care. While respecting autonomy, nurses also have a duty to advocate for patient well-being and encourage evidence-based preventive measures. This approach could lead to missed opportunities for early detection and prevention of disease. The professional reasoning process should involve a thorough assessment of the patient's health literacy, cultural beliefs, and personal values related to preventive care. The nurse should then engage in open-ended communication, providing clear, unbiased information about the benefits and risks of the screening and vaccination. Collaborative goal setting and addressing any identified barriers are crucial steps in developing a mutually agreed-upon plan that respects the patient's autonomy while promoting their health. Question 15. During the evaluation of a post-operative patient, the registered nurse notes that the patient is grimacing, guarding their abdomen, and rates their pain as an 8 on a 0-10 scale. The patient states, "I really need something for this pain." The nurse checks the electronic health record and finds that the patient's last PRN analgesic order expired yesterday, and there are no current orders for pain medication. What is the most appropriate nursing action? Option A. Contact the physician to obtain a new order for pain medication. Option B. Advise the patient to try deep breathing exercises and wait until morning to discuss pain management with the physician. Option C. Administer the previously prescribed PRN analgesic as the patient's pain is severe. Option D. Document the patient's pain level and wait for the physician to make rounds in the morning. The correct answer is A. Contact the physician to obtain a new order for pain medication. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the patient's immediate need for pain relief with the potential for adverse drug reactions and the legal/ethical implications of administering medication without a clear physician's order. The nurse must exercise sound clinical judgment, adhere to established protocols, and prioritize patient safety while respecting the scope of practice. Correct approach analysis. The correct approach involves the nurse recognizing the patient's distress and the potential need for pain medication, but prioritizing patient safety and legal compliance by contacting the physician. This aligns with the Nurse Practice Act and professional nursing standards, which mandate that nurses practice under the direction of a licensed physician or advanced practice registered nurse. Administering a PRN analgesic without a current, valid order would constitute practicing beyond the scope of practice and could lead to disciplinary action, as well as potential harm to the patient if the medication is contraindicated or if the underlying cause of pain is not addressed. The nurse's responsibility is to advocate for the patient by seeking appropriate medical orders to ensure safe and effective care. Incorrect approach is analysis. Administering the PRN analgesic without a current order is a direct violation of the Nurse Practice Act, which defines the scope of nursing practice. It bypasses the physician's assessment and prescription authority, potentially leading to medication errors, adverse drug events, and a breach of the nurse-patient relationship. Ethically, it is a failure to uphold the principle of non-maleficence, do no harm, and beneficence, act in the patient's best interest, documenting the patient's pain, but taking no further action until the physician rounds is incorrect, because it fails to adequately address the patient's immediate suffering and advocate for their needs. While documentation is crucial, it should be coupled with appropriate interventions, including seeking orders for pain management when indicated and within the nurse's scope of practice. This approach could be seen as a failure to provide timely and effective care, potentially violating standards of care. Suggesting the patient wait until morning to discuss pain management with the physician is also incorrect. It dismisses the patient's current discomfort and fails to recognize the nurse's role in assessing and managing pain. Pain is a subjective experience that requires prompt attention, and delaying management can lead to increased suffering, anxiety, and potentially more complex pain issues. This approach neglects the nurse's ethical obligation to alleviate suffering. Professional reasoning. When faced with a patient experiencing pain and a lack of a current order for pain medication, the professional decision-making process should involve 1. Assess the patient's pain level and characteristics. 2. Review the patient's chart for any existing orders or relevant medical history. 3. If no current order exists, contact the physician or advanced practice registered nurse to report the patient's pain and request an order. 4. If the physician is unavailable and the pain is severe, follow facility policy for emergency situations or on-call physician contact. 5. Document all assessments, communications, and interventions accurately. This systematic approach ensures patient safety, legal compliance, and ethical practice. Question 16. Process analysis reveals a patient experiencing moderate postoperative pain following a surgical procedure. The physician's order is for intravenous morphine 2 mg every 4 hours as needed for pain. The nurse notes the patient appears restless and is grimacing. The nurse has administered the previous dose 3 hours ago. What is the most appropriate nursing action? Option A. Administer 4 mg of morphine, double the prescribed dose, to ensure adequate pain relief. Option B. Administer the prescribed dose of morphine now, but do not perform a specific pain assessment until the next scheduled shift. Option C. Administer the prescribed dose of morphine now and perform a focused assessment of the patient's pain and vital signs within 15-30 minutes. Option D. Withhold the morphine until the full 4-hour interval has passed to avoid potential oversedation. The correct answer is C. Administer the prescribed dose of morphine now and perform a focused assessment of the patient's pain and vital signs within 15-30 minutes. Explanation. This scenario is professionally challenging because it requires the nurse to balance the patient's immediate need for pain relief with the potential for adverse effects and the need for ongoing assessment. The nurse must make a rapid, informed decision about the most appropriate intervention based on the patient's current status and the prescribed medication. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the nursing process. Administering the medication as prescribed, followed by a thorough assessment, ensures that the patient receives the intended therapeutic benefit while allowing the nurse to monitor for effectiveness and potential side effects. This aligns with the Nurse Practice Act, which mandates that registered nurses implement care plans and evaluate patient responses. Ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, are upheld by this systematic approach. An incorrect approach of delaying administration due to a vague concern without further assessment fails to address the patient's pain promptly, potentially violating the principle of beneficence and the patient's right to adequate pain management. This could also be seen as a failure to implement the prescribed plan of care. Another incorrect approach of administering a higher dose than prescribed is a serious regulatory and ethical failure. It constitutes practicing outside the scope of the nursing license, violating the Nurse Practice Act by administering a medication without a valid order. This directly contravenes the principle of non-maleficence, as it significantly increases the risk of adverse drug events and overdose. A third incorrect approach of administering the medication without subsequent assessment is also professionally unacceptable. While the medication is administered, the lack of follow-up assessment means the nurse cannot determine if the medication is effective, if the patient is experiencing adverse effects, or if the pain management plan needs adjustment. This failure to evaluate patient response is a critical gap in the nursing process and violates the mandate to provide ongoing, comprehensive care. The professional decision-making process in such situations involves 1. Recognizing the patient's need, pain. 2. Reviewing the prescribed intervention, medication and dosage. 3. Assessing the patient's current status for contraindications or immediate concerns. 4. Implementing the intervention as ordered. 5. Evaluating the patient's response and reassessing as needed. This systematic approach, grounded in the nursing process and regulatory requirements, ensures safe and effective patient care. Question 17. The risk matrix shows a post-operative patient experiencing sudden onset of shortness of breath and sharp chest pain. The nurse's initial actions should focus on Option A. Administering a prescribed opioid analgesic for pain management. Option B. Administering supplemental oxygen and assessing the patient's respiratory status, including lung sounds and oxygen saturation. Option C. Immediately notifying the surgeon of a potential surgical complication without further assessment. Option D. Asking the patient to describe the pain in detail before taking any other action. The correct answer is B. Administering supplemental oxygen and assessing the patient's respiratory status, including lung sounds and oxygen saturation. Explanation: scenario analysis. This scenario is professionally challenging because it involves a patient experiencing a sudden, potentially life-threatening physiological change, dyspnea and chest pain, in a post-operative setting. The nurse must rapidly assess the situation, differentiate between common post-operative discomfort and a critical complication, and initiate appropriate interventions while considering the patient's underlying condition and surgical procedure. The urgency of the symptoms necessitates immediate, accurate clinical judgment. Correct approach analysis. The correct approach prioritizes immediate assessment and intervention for potential cardiopulmonary compromise. This aligns with the fundamental nursing responsibility to protect patient safety and provide timely care, as mandated by the Nurse Practice Act and established nursing standards of care. Promptly assessing vital signs, oxygen saturation, and auscultating lung sounds provides critical data to guide further action, such as administering oxygen and notifying the healthcare provider. This systematic, evidence-based approach ensures the patient receives the most critical interventions first, minimizing the risk of adverse outcomes. Incorrect approaches analysis. One incorrect approach involves delaying assessment to gather more subjective information from the patient. While patient reporting is important, in the face of acute dyspnea and chest pain, objective physiological data is paramount for immediate diagnosis and treatment. Delaying objective assessment could lead to a critical delay in recognizing and managing a life-threatening condition like pulmonary embolism or myocardial infarction, violating the nursing duty of care. Another incorrect approach is to assume the symptoms are solely due to post-operative pain and administer only pain medication without further assessment. This is a dangerous assumption that overlooks potentially severe complications. Failing to assess for signs of cardiopulmonary distress and instead relying on a single diagnostic assumption is a breach of professional judgment and could result in significant harm to the patient, contravening the ethical principle of non-maleficence. A third incorrect approach is to immediately escalate to the most advanced interventions, such as preparing for intubation, without a thorough initial assessment. While preparedness is important, premature escalation without a clear indication based on objective data can lead to unnecessary interventions, patient distress, and a misallocation of resources. This demonstrates a lack of critical thinking and adherence to a systematic assessment process. Professional reasoning. When faced with a patient experiencing acute physiological distress, the professional decision-making process should follow a structured approach. 1. Rapid assessment. Immediately assess the patient's airway, breathing, circulation, and vital signs. 2. Data gathering. Collect objective data, e.g., vital signs, oxygen saturation, lung sounds, cardiac rhythm, and relevant subjective data. 3. Prioritization. Determine the most life-threatening issues based on the collected data. 4. Intervention. Implement evidence-based interventions to address the prioritized issues. 5. Communication. Notify the healthcare provider promptly with a clear, concise report of findings and interventions. 6. Reassessment. Continuously monitor the patient's response to interventions and adjust care as needed. Question 18. Regulatory review indicates that a registered nurse is providing education to a patient newly diagnosed with type 2 diabetes regarding lifestyle modifications, including dietary changes and increased physical activity. The patient expresses that their cultural traditions involve communal meals with specific high-carbohydrate dishes, and that their religious beliefs discourage strenuous physical exertion during certain times of the year. The nurse needs to determine the most appropriate approach to address these concerns while promoting effective diabetes management. Option A. Inform the patient that adherence to standard dietary guidelines and exercise recommendations is non-negotiable for managing diabetes, regardless of cultural or religious practices. Option B. Focus solely on the medical aspects of diabetes management and avoid discussing the patient's cultural or religious beliefs, assuming they will adapt over time. Option C. Advise the patient to temporarily set aside their cultural and religious practices during the initial intensive phase of diabetes management to ensure rapid improvement. Option D. Acknowledge the patient's cultural and religious practices, explore their understanding of how these might impact diabetes management, and collaboratively develop a modified plan that incorporates their beliefs and values while still aiming for health goals. The correct answer is D. Acknowledge the patient's cultural and religious practices, explore their understanding of how these might impact diabetes management, and collaboratively develop a modified plan that incorporates their beliefs and values while still aiming for health goals. Explanation. Scenario analysis. This scenario presents a common challenge in nursing practice where a patient's personal beliefs and cultural practices may conflict with recommended lifestyle modifications for their health. The nurse must navigate this delicate situation with sensitivity, respect, and adherence to professional standards, ensuring patient autonomy while promoting well-being. The challenge lies in finding a balance that honors the patient's values without compromising their health outcomes, requiring a deep understanding of ethical principles and patient-centered care. Correct approach analysis. The correct approach prioritizes open communication, active listening, and collaborative goal setting. By acknowledging the patient's beliefs and exploring their understanding of the recommended modifications, the nurse demonstrates respect for their autonomy and cultural background. This approach aligns with the nursing code of ethics, which emphasizes patient advocacy, respect for diversity, and the right to self-determination. It also adheres to the principles of patient-centered care, where the patient is an active participant in their treatment plan. The nurse's role is to educate, support, and empower the patient to make informed decisions that are congruent with their values and health needs, fostering trust and adherence. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's beliefs as irrelevant or misinformed. This violates the ethical principle of respect for persons and can lead to patient alienation, distrust, and non-adherence to care. It fails to recognize the patient's right to cultural and personal autonomy, which is a cornerstone of ethical nursing practice. Such an approach can also be seen as paternalistic, undermining the patient's capacity for self-governance. Another incorrect approach is to impose the recommended modifications without fully understanding the patient's perspective or exploring potential compromises. This disregards the patient's individual circumstances and values, leading to a breakdown in the therapeutic relationship. It fails to acknowledge that lifestyle modifications must be sustainable and meaningful to the patient to be effective. This approach can also lead to unintended negative consequences if the imposed changes are not culturally or personally viable for the patient. A third incorrect approach is to avoid the discussion altogether, assuming the patient will eventually comply or that it is not the nurse's responsibility to address cultural conflicts. This abdication of responsibility is a failure in professional duty and patient advocacy. It neglects the nurse's role in facilitating understanding and supporting the patient through complex health decisions, potentially leading to poorer health outcomes and missed opportunities for effective intervention. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's beliefs, values, and understanding of their health condition and recommended interventions. This is followed by open, non-judgmental communication to explore any conflicts or concerns. The nurse should then collaborate with the patient to identify mutually agreeable strategies that incorporate their cultural or personal preferences while still addressing health goals. This process requires empathy, cultural competence, and a commitment to patient empowerment and shared decision-making, always guided by ethical principles and professional standards of practice. Question 19. The performance metrics show a trend of nurses in a specific unit delaying interventions for patients exhibiting signs of respiratory distress. A registered nurse is caring for a patient who has a decreased respiratory rate of 8 breaths per minute and shallow respirations. The patient reports feeling increasingly short of breath and anxious. What is the most appropriate initial nursing action? Option A. Administer a prescribed opioid analgesic to alleviate the patient's reported pain and anxiety. Option B. Document the patient's vital signs and subjective complaints in the electronic health record. Option C. Encourage the patient to take slow, deep breaths and practice relaxation techniques. Option D. Assess the patient's oxygen saturation and administer supplemental oxygen as prescribed. The correct answer is D. Assess the patient's oxygen saturation and administer supplemental oxygen as prescribed. Explanation: scenario analysis. This scenario is professionally challenging because it requires the nurse to integrate knowledge of basic human anatomy and physiology with critical thinking to assess a patient's condition and respond appropriately. The challenge lies in recognizing subtle but significant physiological changes that could indicate a serious underlying problem, necessitating prompt and accurate intervention. The nurse must move beyond simply observing symptoms to understanding the physiological basis of those symptoms. Correct approach analysis. The correct approach demonstrates best professional practice by directly addressing the physiological implications of the patient's presentation. Understanding that a decreased respiratory rate and shallow breathing can lead to inadequate gas exchange, resulting in hypoxemia and hypercapnia, is fundamental. This physiological understanding guides the nurse to prioritize interventions that support airway, breathing, and circulation, such as assessing oxygen saturation and administering oxygen as prescribed. This aligns with the nursing scope of practice and the ethical obligation to provide safe and effective patient care, as mandated by the Nurse Practice Act and established nursing standards of care. Incorrect approaches analysis. One incorrect approach might involve focusing solely on the patient's reported discomfort without assessing the underlying physiological cause. This fails to recognize the potential for serious respiratory compromise and could delay life-saving interventions, violating the duty of care and potentially leading to patient harm. Ethically, this demonstrates a lack of diligence and a failure to prioritize patient safety. Another incorrect approach could be to administer a sedative medication without a thorough respiratory assessment. This would be a significant regulatory and ethical failure. Sedatives can further depress respiratory function, exacerbating the very problem the patient is experiencing. This action would contravene the principles of safe medication administration and patient assessment, directly violating the Nurse Practice Act's requirements for competent and safe practice. A third incorrect approach might be to document the findings, but take no immediate action, assuming the patient will stabilize on their own. This passive approach is a dereliction of duty. The Nurse Practice Act mandates that nurses actively assess, intervene, and advocate for their patients. Failure to act on critical physiological signs constitutes professional negligence and a breach of ethical responsibility. Professional reasoning. Professionals should employ a systematic approach to patient assessment, starting with a thorough head-to-toe assessment, prioritizing ABCs, airway, breathing, circulation. This involves not only observing signs and symptoms, but also understanding the underlying physiological mechanisms. When physiological changes are noted, the nurse must consider potential causes and implement appropriate interventions based on established protocols and their scope of practice. This decision-making process is guided by the Nurse Practice Act, ethical codes, and evidence-based practice, ensuring patient safety and optimal outcomes. Continuous monitoring and reevaluation are crucial components of this process. Question 20. Process analysis reveals that a competent adult patient, diagnosed with a treatable but potentially progressive condition, is refusing a recommended diagnostic procedure that is crucial for determining the most effective treatment plan. The patient states they are tired of being poked and prodded and expresses a desire to go home, despite understanding the potential long-term consequences of delaying diagnosis. The registered nurse is tasked with evaluating the patient's decision-making capacity and ensuring their rights are upheld, while also considering the ethical imperative to promote the patient's well-being. Option A. Contact the patient's family without the patient's explicit consent to discuss the situation and seek their influence in persuading the patient to undergo the procedure. Option B. Inform the patient that their refusal is not in their best interest and strongly encourage them to reconsider, emphasizing the severe health risks associated with delaying the diagnostic procedure. Option C. Document the patient's refusal of the procedure and proceed with discharge planning, assuming the patient is fully informed and has the right to refuse any medical intervention. Option D. Engage the patient in a detailed conversation to explore their understanding of the procedure, the potential risks and benefits of undergoing it, and the consequences of refusal. Ascertain the underlying reasons for their refusal and offer alternative approaches or reassurance, involving the interdisciplinary team to support the patient's decision-making process. The correct answer is D. Engage the patient in a detailed conversation to explore their understanding of the procedure, the potential risks and benefits of undergoing it, and the consequences of refusal. Ascertain the underlying reasons for their refusal and offer alternative approaches or reassurance, involving the interdisciplinary team to support the patient's decision-making process. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interests of the patient as determined by the healthcare team. The nurse must navigate this ethical dilemma while adhering to the principles of patient autonomy, beneficence, and non-maleficence, all within the framework of the Nurse Practice Act and ethical codes governing registered nurses in the United States. The challenge lies in respecting the patient's right to self-determination, even when their choices may lead to outcomes the nurse believes are detrimental. The correct approach represents best professional practice because it prioritizes open communication, patient education, and collaborative decision-making. By engaging in a thorough discussion with the patient, exploring their understanding of the situation, and identifying the underlying reasons for their refusal, the nurse upholds the principle of patient autonomy. This aligns with the American Nurses Association ANA Code of Ethics, which emphasizes the nurse's responsibility to advocate for patients and respect their right to make informed decisions about their care. Furthermore, involving the interdisciplinary team ensures that all perspectives are considered and that the patient receives comprehensive support. An incorrect approach that involves overriding the patient's wishes without further exploration or attempting to coerce them into a decision violates the fundamental ethical principle of autonomy. This would be a direct contravention of the patient's right to self-determination, a cornerstone of ethical nursing practice and patient rights legislation. Another incorrect approach, such as documenting the refusal without attempting to understand the patient's rationale or offering alternatives, fails to meet the standard of care and the ethical obligation to provide comprehensive patient education and support. This could be seen as a breach of the nurse's duty to advocate for the patient and ensure their understanding of their treatment options. Professionals should employ a decision-making framework that begins with identifying the ethical issue. This is followed by gathering all relevant information, including the patient's wishes, medical status, and available treatment options. Next, the nurse should explore the ethical principles at play and consider the potential consequences of each course of action. Open communication with the patient and the healthcare team is crucial. Finally, the nurse should act in accordance with ethical guidelines and legal requirements, documenting all interventions and decisions thoroughly.